Assalamu alaikum. The next topic we will be discussing is the abducent nerve. It is the sixth cranial nerve. Also, one thing to remember, it is a motor nerve. It doesn't have a sensory component to it. It has a nucleus which is present in the lower pons beneath the facial calculus. It exits the brainstem anteriorly. As I said, the trochlear nerve is the only nerve which exits the brainstem dorsal to it from the brainstem, while every other cranial nerve exits the brainstem anterior to it. Abducent nerve exits the brainstem, enters the posterior cranial fossa, and then enters into the cavernous sinus, which is present in the middle cranial fossa, at the location of the petrous part of temporal bone at the apex of the cavernous sinus. It has a relation with internal carotid artery in the cavernous sinus, which is present laterally, and then in the anterior part, it becomes infralaterally, the abducent nerve. The abducent nerve then passes through the cavernous sinus and enters through the superior orbital fissure into the orbit. It enters the superior orbital fissure at the middle part and then supplies the lateral rectus of the muscle of the extraocular of the orbit. Again, I will repeat. It has a nucleus at the lower level of pons. It exits the brainstem and enters the posterior cranial fossa, and then enters the cavernous sinus, which is present to middle cranial fossa. Cavernous sinus के कौन से part से ये enter करती है? It enters the cavernous sinus from the petrous part of temporal bone, जो apex होता है cavernous sinus का, and then it has a relation with internal carotid artery in the cavernous sinus. पहले वो lateral होती है internal carotid की, and then it becomes inferior lateral. वो exit करती है cavernous sinus से, and then middle part of superior orbital fissure से वो enter करेगी orbit के अंदर, and orbit जो कि हम बात करें इंटीरियर क्रेनियल फोसा के अंदर है, abducent nerve क्रॉस करके सुपीरियर ऑर्बिटल फिशर से लैटरल रेक्टस को सप्लाई कर देगी.